Welcome to Lesson 4 of the KS Medical Coding Academy course. In this session, we will learn pathophysiology and disease concepts, one of the most essential areas for understanding how diseases begin, progress, and affect the human body. This knowledge is extremely important for accurate ICD-10-CM coding. What is pathophysiology? Pathophysiology explains what happens inside the body when a disease develops. It is the combination of pathology, which is the study of disease, and physiology, which is the study of how the body normally works. When these two come together, we understand why symptoms occur and how diseases affect organs and systems. Why pathophysiology matters in coding. Medical coders must go beyond memorizing codes. You need to understand the story behind each diagnosis. The cause of the disease, the severity, whether it is acute or chronic, any complications, and the underlying condition all influence ICD-10 code selection. Strong knowledge of pathophysiology helps you choose the correct and most specific codes. Levels of disease. Disease affects the body at multiple levels. It begins at the cellular level, then spreads to tissues, organs, and entire systems. Coding often requires identifying which organ or system is affected and how severely it is damaged. This level of detail comes from understanding pathophysiology. Causes of diseases, etiology, types of etiology. Diseases can occur for many reasons, called etiology. These include infectious agents like bacteria and viruses, genetic abnormalities, autoimmune reactions, environmental exposure, lifestyle factors such as smoking or diet, idiopathic causes where the reason is unknown, and iatrogenic causes, meaning disease caused by medical treatment itself. Infectious diseases. Infectious diseases are caused by microorganisms such as bacteria, viruses, fungi, and parasites. Examples include pneumonia, tuberculosis, urinary tract infections, and COVID-19. As coders, when an organism is identified, we must code it specifically rather than using an unspecified code. Genetic disorders. Genetic or congenital disorders are present from birth. These may include Down syndrome, congenital heart defects, cystic fibrosis, and hemophilia. These conditions have their own ICD-10 chapter, Chapter 17, which coders must be familiar with when assigning congenital codes. Autoimmune diseases. Autoimmune diseases occur when the body mistakenly attacks its own tissues. Examples include rheumatoid arthritis, lupus, Hashimoto's thyroiditis, and type 1 diabetes. Autoimmune conditions can affect multiple organs and often require coding both the disease and its manifestations. Lifestyle-related diseases. Certain diseases develop due to long-term habits and lifestyle choices. Examples include diabetes type 2, hypertension, obesity, and liver disease from alcohol use. When risk factors are mentioned, coders may need to assign Z codes to fully capture the patient's health status. Environmental causes. Environmental disorders are caused by exposure to chemicals, pollutants, allergens, toxins, or radiation. Common examples include allergic dermatitis, asthma exacerbation due to pollution, and chemical poisoning. Documentation often includes the cause, which helps coders assign proper external cause codes. Disease development, pathogenesis, steps of disease development. Most diseases follow a sequence. First comes exposure to a harmful agent. Then comes incubation or onset, followed by cellular damage. In response, the body triggers inflammation. Symptoms appear, and finally, the disease either progresses or the patient recovers. Coders must look for these clues in clinical documents. Inflammation. Inflammation is one of the body's most common responses to injury or infection. The signs include redness, heat, swelling, pain, and loss of function. Inflammatory conditions often need site-specific codes and sometimes, with, or, due to, coding notes. Acute versus chronic conditions. Acute conditions start suddenly and last for a short time, like appendicitis. Chronic conditions develop slowly and last for months or years, like COPD or diabetes. ICD-10 distinguishes between acute, chronic, and sometimes acute on chronic states, so coders must always capture the correct severity. Recurrent and exacerbated diseases. Recurrent diseases happen repeatedly, such as recurrent UTIs. Exacerbations occur when a chronic disease worsens, such as asthma with acute exacerbation. These details dramatically change the code selection and should never be missed. Complications of diseases. Some diseases cause complications that must be coded separately. For example, diabetes may lead to neuropathy or kidney disease. Hypertension may lead to heart failure. In these cases, coders must connect the underlying disease with its complication using ICD-10 guidelines. Symptoms and clinical presentation. Slide 16. What are symptoms? Symptoms are the indicators that something is wrong in the body. They can be subjective, such as nausea or dizziness, or objective, such as fever or swelling. Coders assign symptom codes only when no confirmed diagnosis is documented. Common symptoms. Common symptoms include cough, fever, chest pain, back pain, headache, vomiting, and shortness of breath. These codes are found in Chapter 18 of ICD-10. Always code symptoms only when there is no definitive diagnosis. Syndromes. A syndrome is a group of symptoms that occur together. Examples include metabolic syndrome, polycystic ovary syndrome, and Down syndrome. Some syndromes require combined coding rules or additional manifestation codes. ICD-10 Disease Classification Concepts. Underlying versus manifestation. Some conditions have an underlying cause that produces a secondary condition. For example, diabetes may cause neuropathy. The ICD-10 rules require that the underlying condition be coded first, followed by the manifestation. Coders must watch for notes such as "code first" or "use additional code." Primary versus secondary diagnosis. The primary diagnosis is the main reason for the patient's visit. Secondary diagnoses are additional conditions that influence treatment or require attention during the encounter. Both must be coded when relevant. Sequelae. A sequela is a residual effect after the original disease has resolved. For example, paralysis after a stroke or scarring after a burn. ICD-10 requires that the current problem be coded first, followed by the sequela code representing the original cause. Complications. Complications arise when a disease leads to another condition, such as diabetic nephropathy or hypertension leading to heart failure. Coders must clearly document the cause and effect relationship. Combined conditions. Some diseases are listed as combined conditions in ICD-10 because they often occur together. Examples include hypertensive heart disease, COPD with acute bronchitis, and diabetes with kidney complications. Combined codes simplify documentation but require coders to confirm the relationship. System and organ failure. Organ failure basics. Organ failure occurs when an organ can no longer perform its normal function. Coders must identify the organ involved and whether the failure is acute, chronic, or acute on chronic. Cardiac failure. Heart failure occurs when the heart cannot pump blood effectively. It may be acute, chronic, or combined. ICD-10 requires coders to capture type, stage, and cause, such as hypertensive heart failure. Respiratory failure. Respiratory failure occurs when the lungs cannot supply enough oxygen or remove carbon dioxide. Documentation may state acute, chronic, or acute on chronic, and these terms change the code dramatically. Renal failure. Kidney failure may be acute kidney injury, chronic kidney disease, or end-stage renal disease. CKD has stages from 1 to 5, and coders must always document the exact stage for accurate coding. Liver failure. Liver failure arises from conditions such as alcoholic liver disease, viral hepatitis, or drug-induced injury. Coders must look for terms such as cirrhosis, hepatic encephalopathy, and portal hypertension. Disease progression examples. Infection progression. An infection like pneumonia can progress to severe complications such as sepsis or septic shock. Each level of progression has separate ICD-10 codes that must be documented carefully. Cancer progression. Cancer progresses through stages 0 to 4, with metastasis representing the spread to other organs. Coders must capture the primary site, secondary sites, and treatment status such as in remission or history of. Diabetes progression. Diabetes begins with insulin resistance and progresses to complications such as neuropathy, retinopathy, and kidney disease. Combined codes help identify the relationship between diabetes and its complications. Applying pathophysiology in coding. Example 1. For the diagnosis, diabetes with chronic kidney disease, stage 4, coders must capture diabetes as the underlying condition and CKD4 as the manifestation, following the Code First guideline. Example 2. For hypertension with heart failure, ICD-10 provides a combined code for hypertensive heart disease with heart failure. Coders must also identify the type of heart failure for complete accuracy. Example 3. For COPD with acute exacerbation, the coder must capture both the chronic condition and the acute flare-up, selecting the specific code that reflects exacerbation. Summary of lesson. In this lesson, we covered the foundation of pathophysiology, how diseases begin, progress, and affect the body. We explored causes of diseases, acute and chronic conditions, complications, symptoms, ICD-10 concepts, organ failures, and real-world coding examples. This knowledge strengthens your ability to choose accurate codes with confidence.